The medical system of North Korea is one of the most closed and inaccessible structures in the world, hiding a catastrophic reality behind a facade of propaganda. The regime's official rhetoric proudly proclaims free medical care for all citizens and the achievements of a healthcare system built on the principles of socialist concern for the individual. However, testimonies of defectors, rare photographs, and data from international organizations paint a completely different picture of the country's hospital system. Inside North Korean hospitals, there is poverty on a scale hard to imagine for residents of developed countries, with basic medicines and equipment missing. Patients are forced to bring not only medicines but even bandages, syringes, and bed sheets because hospitals cannot provide basic consumables. Surgeries are performed without anesthesia or with minimal pain relief because anesthetics are scarce and available only to high-ranking party officials. Hospital buildings in North Korea are in a state of critical disrepair. Many have not been repaired since they were built in the 1950s or the 1960s. Walls are covered with mold and cracks, paint peeled decades ago. And windows are often broken or boarded up, turning wards into cold and dark rooms. Heating operates extremely regularly, even in harsh winter months when temperatures drop to -20 to -30 degrees Celsius. Patients lie in their clothes under blankets brought from home, trying to keep warm in icy wards where their breath turns to steam. Electricity is supplied for a few hours a day, and in provincial hospitals there may be none for weeks, making it impossible to use even the equipment that exists. Water supply is also intermittent. Medical staff carry water in buckets from wells or nearby rivers, creating unsanitary conditions and an increased risk of infections. Medical equipment in North Korean hospitals is like museum exhibits, long outdated and often non-functional due to a lack of spare parts and electricity. X-ray machines may have been manufactured in the Soviet Union or China half a century ago and function only in the largest medical centers in the capital. Surgical instruments are reused without proper sterilization. They are washed with plain water and wiped with alcohol if the hospital has any. Disposable syringes and needles are rare and are reused on multiple patients, leading to widespread transmission of infectious diseases. Gloves, masks, and other protective gear for medical staff are practically absent. Doctors and nurses work unprotected, risking their own health daily. Diagnostic equipment such as ultrasound machines or CT scanners exists only in elite Pyongyang hospitals serving the party nomenclatura and their families. The shortage of medicines in North Korean hospitals has reached such a level that doctors are forced to resort to folk remedies and homemade drugs of questionable efficacy. Antibiotics, painkillers, and other basic medicines are scarce and can only be bought on the black market for sums that are enormous for the average North Korean. Patients must find and bring the necessary drugs themselves, otherwise treatment will simply not begin, regardless of the severity of the condition or the threat to life. Many die from treatable illnesses such as appendicitis or pneumonia simply because they could not obtain the necessary medicines in time or pay a doctor. Surgical operations are performed using homemade alcohol-based anesthetics or without pain relief at all. Patients scream in pain while orderlies hold them down. Post-operative care is almost non-existent. Wounds often become infected, leading to sepsis and death even after technically successful operations. Hospital food is so meager that relatives are obliged to bring food to patients. Otherwise, they will starve during treatment and recovery. Hospital rations consist of liquid corn porridge 1 to 2 times a day, which contains virtually none of the nutrients needed for the body's recovery. Many patients lose weight during their hospital stay. Their condition deteriorates not only from illness, but also from exhaustion and vitamin deficiency. Families are forced to spend their last savings to buy food at the market to bring to their sick relatives in the hospital every day. Patients who have no relatives or whose families are too poor often die of hunger right in the hospital wards, among other patients. Medical personnel also suffer from malnutrition. Doctors and nurses work at the limit of their physical capacities, themselves in need of medical care and proper nutrition. Corruption permeates the entire North Korean medical system, turning formerly free healthcare into a system accessible only to those who can pay bribes. Doctors demand money, food, or goods for any medical services, from a simple examination to complex surgeries, because their salaries are meager and irregular. The size of the bribe determines the quality and speed of care. Those who cannot pay are neglected and die in hospital corridors. Medications arriving as humanitarian aid from international organizations are embezzled by officials and sold on the black market at inflated prices. Even a bed space in a ward requires payment. Otherwise, the patient is placed in the corridor on the bare floor without a mattress or blanket, lying among other outcasts. This system of unofficial payments makes medical care inaccessible to the majority of the population, especially rural residents and members of lower social classes. Hygienic conditions in North Korean hospitals are catastrophically poor, promoting the spread of infections and complications among already weakened patients. Toilets do not function due to lack of water supply, becoming sources of stench and unsanitary conditions where waste accumulates and pathogenic bacteria multiply. Ward cleaning is performed rarely and superficially. Trash and medical waste accumulate in corners, creating an ideal environment for infections and parasites,